We're going to get started with Dr. Andrew Mendonsa, and he oversees clinical and program operations for Sacramento County Substance Use Prevention and Treatment Unit. And for over 15 years, Dr. Mendonsa has been actively involved in the fields of substance abuse, mental health, and forensic psychology. He is licensed to practice in over a dozen states and has presented topics around the nation and the world, including in Canada and Europe. He has been featured in countless national media, including Forbes, USA Today, NBC News, NPR, and the HuffPost, discussing topics such as suicide, mental health, and substance abuse. So today, Dr. Mendonsa is going to be talking to us and giving us an update on opioid data and youth-related findings. So Andrew, please take it away.
Great, thank you, Lindsay, and thank you for the opportunity to present today. So I'm just going to give a pretty high-level overview for some of the data that's coming out of Sacramento County, California, and across the nation, and then I'll be handing it off to my colleague, Tricia Parker, who's going to be doing a little bit of a deeper dive into some of the data and trends and some of the pulse that we're hearing of what's going on in Sacramento County related to some of the trends of youth substance use. So let me go ahead and get started, and I'll put my information in the chat as well when I finish up. So you're welcome to reach out if you need a copy of this PowerPoint or have any questions or anything I can answer. I'll put my information in the chat. So a recent article came out, wanted to highlight for everybody. Recent surge in drug overdose deaths have shocked everyone. We have about, across America, about 100,000 dead between the April 2020 to April of 2021. First time that that the figure has topped six figures. We know that the pandemic has not helped whatsoever in the opioid epidemic and the drug use across the nation. And so we're continuing to see numbers increase while we continue to be in a pandemic and continue to struggle with COVID. A lot of folks are using drugs more than they intended to, or taking up different kinds of drugs just because addressing either self-medicating or for a variety of reasons. So we certainly are concerned about this as what we're seeing here in Sacramento County. We're continuing to see, like I said, across the state and across the nation. So this is certainly a national epidemic that we're experiencing in regards to opioid increase in use. The journal Drug and Substance Abuse published in December 16th of last year that fentanyl overdoses became the #1 cause of death among U.S. adults ages 18 to 45, and they're declaring it in a national emergency. And again, for any of us that are involved here in Sacramento County or working in work groups in our neighboring counties, we know that this is not new to us. We are seeing this, we're seeing the effects of this every day out here in our communities. And more adults between the ages of 18 to 45 died of fentanyl overdose in 2020 than COVID, motor vehicle accidents, cancer, and suicide. So again, this is something that we really want to take to heart and make sure that we really recognize just how quickly this cause of death is surpassing the other causes of death that typically, have taken the lion's share of death in our community. So here's some data I'm going to present for the next couple slides. This data comes from the Sacramento County Coroner's Office. This is the most accurate data that we have at this moment. It's only a couple days old that I was able to receive it, so I wanted to share this data with you. Here in the data, we're showing about 110 fentanyl-involved deaths, and this is specific to Sacramento County, and again, the cause of death from the Coroner's Office. As you'll see, the red are females and the blue are males, and we're seeing here ages 20, 30, and 33. So that kind of grouping of age accounts for a large majority of the deaths in Sacramento County. But really, when you look at the numbers, really what separates high versus not high are only 1 or 2 deaths. So really, if you're looking at this, from ages 20, you're really seeing that it's affecting every age group, 20s, 30s, 40s. And as I'll get into in just a few slides from now, we're seeing it have a effect on our elderly population as well. And there's some theories and hypotheses around why we're starting to see kind of, we call it the bookends in data, where the young and the old are beginning to get more and more affected. And so certainly we want to keep an eye on that about why we're seeing the, seeing these effects in our youth and in our elderly population. But again, 20s, 30s continue to be a problem in Sacramento County in those age groups. Next slide I wanted to share with you is these are numbers of methamphetamine deaths. So again, we're talking about opioids, but as Lori mentioned earlier, we don't want to lose sight that methamphetamine continues to be the #1 used drug here in Sacramento and in many communities. And so we were able to get some data that's specific to methamphetamine deaths. And so I wanted to present that today as well, so we could really see of how these two substances are really, really affecting youth and adults in Sacramento County. So we're seeing here 191 meth-involved deaths in Sacramento. Ages here are a little bit different than the age profile that we see in the fentanyl and opioid deaths. Here around 50s, mid-50s to 60s, around that age group account for the lion's share of death. But again, as you can see in the data distribution here, really the difference between high in the 50s and over here in the middle are only 1 or 2 deaths. So again, this is a significant issue that we want to not lose sight of, that while we're combating opioids, we also want to make sure that we're combating methamphetamine as well, as this is the undercurrent is still very much there and affecting the lives of people in Sacramento County. So when we combine methamphetamine and fentanyl deaths, it looks like about 46 deaths are accounted for when both of those are combined. And again, looking at 30, 50, 20s, 30s, again, very much accounted for in almost every age group as well. But 30-year-olds tend to account for most of the death. And until we get into our 30s, mainly the combination has been seen in males. In folks that are male that die from a combination. So more males are dying from a combination use of fentanyl and meth than females based on this data. Wanted to highlight some of the data. This comes from our friends and our partners over at Song for Charlie. And again, if you haven't been able to take a look at their data, they have really great data sets, really great data analysis on their website. I put their link down at the bottom and I have it at the end too, but to make sure you take a look at their data as well. But I wanted to highlight this for folks on the meeting today, that we are seeing really a sweeping of fentanyl youth deaths across the nation. And I wanted to highlight over here on the second national map here that California had a 503%, and I highlighted that for folks. It's 503% increase in fentanyl deaths. So again, we're not seeing little increases here and there. We're seeing 500% increase. So this is between the difference between 2019, 2020 versus 2017, 2018. So again, a 500% increase over just barely 2 years. So we have a lot of work to do, both here in California and across the nation. Wanted to also highlight some more data from Song for Charlie that they shared with us. Drug deaths are accelerating, and as you may have heard in the past, there is some changes in the nomenclature around how we talk about drug abuse and drug overdose. A lot of the deaths that we're seeing in fentanyl related are folks that bought a pill off of Snapchat, for example, or somewhere off the internet. These are folks that do not have a history of substance abuse or substance misuse. They took one pill and they unfortunately died. And so really we're looking at classifying and talking about those deaths as poisoning versus overdoses, just because out of respect for family and because really these kids are not meeting the criteria that we would typically use to diagnose like substance dependence or substance abuse. These are kind of folks that kind of took one pill and unfortunately died. And as you can see here, between 2015 and 2020, we saw an exponential increase in drug and fentanyl poisonings. And if you can see down here, firearms, motor vehicle suffocation, all the other ways that we typically see death, poisoning surpassed all of those. And so from about 2015 has gradually increased and now account for, again, the majority of deaths in our particular age group, in this particular age group we're talking about. And next one I wanted to share with you, is death related to youth. And again, we saw the youth between the ages of 20 to 24 see an increase versus youth 15 to 24 also saw an increase. And again, teens between 15 and 19 also saw an increase. So these all three groups have seen increases related to drugs associated with drug-induced and drug use over the course of these 5 years. So just again, another data source just to kind of highlight that we're seeing these increases. They're affecting both teenagers and young adults. They're affecting a lot of different age groups. We typically didn't see significantly impacted by drugs in the previous decade or so. Wanted to also highlight this. I found this to be a very, very powerful statistical analysis here. As you can see in 2015, this particular graph shows kind of how much fentanyl really accounted for the larger substance abuse picture. And in 2015, you can see right around here, there was a little bit of it, certainly accounted for about 20%. But here in 2020, just 5 years later, this is how much fentanyl accounts for polysubstance and drug use in 2020. A particular age group here, we can see age groups between 13 all the way to 73 are seeing impacts based on fentanyl and deaths related to fentanyl. There are some racial impacts that we are seeing and continues to be present in the research that's coming out. According to a study of 4 states published in the American Journal of Public Health, a well-respected journal, Black people experienced a 38% increase in opioid overdose deaths between 18 and 19. And some of the preliminary data that's coming out of CDC and coming out of some other reputable sources are reinforcing this and seeing this trend continue. And again, according to the Opioid Research School, is that fentanyl is so potent, its spread has even hurt some of the most experienced drug users. So what we know is folks that have talked to us and said, I know drugs, I'm well experienced in how to do drugs, but fentanyl is simply a beast that a lot of folks just do not know how to navigate, and it's really Russian roulette. And we're seeing this really affect the urban communities, poor Black, Latino men who survived previous addictions and previous outbreaks and spikes in drug use. They're not able to keep up with how potent and how poisonous fentanyl is. And so we're certainly seeing this impact from a racial perspective. My data sources are there. Feel free to take a look. They're clickable links. Like I said, if you'd like this PowerPoint, feel free to reach out to me. I'd love for you to do some more research and take a look and follow these data sources. I think they can be very, very informative for the work that you're all doing. And like I said, I'll put my information up in the chat. And thank you so much for allowing me to present today.
Thank you, Andrew. This is Lori. I just wanted to say to the group that in behavioral health, we have a new behavioral health racial and equity collaborative, and we really want to make sure that we're bringing diversity to all the services and the work that we're doing, both through our opioid coalition means and through our methamphetamine coalition. And we will have an agenda topic on our next meth coalition having to do with that on an ongoing basis to make sure that we are reaching our diverse communities and we are talking about the impacts in these various areas across Sacramento. So thank you, Andrew, for addressing that.